Magandang araw po sa ating lahat, to all third-year students under my facilitation. This is the third topic for the final term in the concept cellular aberrations, acute and chronic. And we have 5 intended learning outcomes that we should attain for today's discussion. The first one is to understand chemotherapy. The second is to review chemotherapeutic drugs because these should be tackled during your nursing pharmacology. Next is to know the common side effects of chemotherapy alongside with the different nursing interventions that we should do to attend our patient. Number 4, know the contraindications of chemotherapy. And lastly, how do we safely handle those chemotherapeutic agents? So let's begin with the understanding chemotherapy. It is said that the era of cancer chemotherapy began in the year 1940s, so medyo matagal na, with the first use of nitrogen mustard and folic acid antagonist drugs. And since then, up to date, clinical studies evolve to give the best possible drug a cancer patient can have to surpass the disease. And also up to this date, chemotherapy is one of the leading means of treatment to cancer patients. So let's first describe what is chemotherapy. So if we will try to break down, chemo meaning chemicals and therapy means treatment. So basically, this is the treatment of the disease by chemical substances. It is the therapeutic use of chemical agents to treat the disease. And since cancer is an aggressive kind of disease, chemotherapy is also an aggressive form of chemical drug therapy meant to destroy rapidly growing cells in the body. And yes, nakadilaw po dyan, no? Rapidly growing cells, meaning actively proliferating cells within a tumor are the most sensitive to chemotherapeutic agents. Kung babalikan po natin yung mga nakaraang discussion natin, alam natin na yung mga cancer cells are actively proliferating cells. Malignant cells ay ang mga cells sa katawan na mabilis dumami. So yes, chemotherapeutic drugs act on them fast. However, we have to take note na hindi lamang po malignant cells ang mabilis ang transition sa katawan natin. Maraming cells in our body that are normal cells na mabilis ding mag-proliferate because basically, it is their characteristic. For example, yung ating balat or the skin, the hair follicle, the gastrointestinal tract cells, the genitourinary tract cells, and many more. And the question is, affected din po ba sila since actively proliferating cells din sila? Kahit normal cells sila? So the answer is yes. Opo. Affected din po sila ng mga chemotherapeutic agent. So we can say that all actively proliferating cells, normal or malignant, ay apektado po ng chemotherapeutic drugs. Yun lang po muna ang gusto kong i-establish doon because we will talk about that later sa later part ng discussion natin. Another thing, how about the not so fast proliferating cells? Non-dividing cells capable of future proliferation are the least sensitive to anti-neoplastic medication. Okay, lilinawin ko lang po ulit. Ano po? Chemotherapeutic drugs act more on rapidly growing cells. Okay, tuloy. The goal of chemotherapy may be to cure, control, or palliation of the manifestation of cancer. And it is systematic intervention. Although there are different routes that might target regional areas, it is done in conjunction with drugs that affect systematically. At hindi pinipili ang chemotherapy basta-basta kagaya ng hindi pagpili sa'yo. There are some parameters bago sasabihin ng doktor na kinakailangan ng mag-chemotherapy ng isang individual. First, nire-recommend po ito if the disease is widespread, the risk of undetectable disease is high, and the tumor cannot be resected and is resistant to radiation therapy. For example, yung tumor po ay sobrang laki na, so pag tinanggal po yung tumor na yon, ang mangyayari matatanggal pati yung skin sa sobrang laki nito, so hindi mag-heal yung sugat ng pagkakatanggal kasi open wound. Kahit magkaroon ng skin grafting ay hindi po ito gagaling. So anong gagawin? Magki-chemotherapy po muna para lumiit po yung bukol at saka po ito ire-resection or tatanggalin. Again, hindi po sa lahat ng pagkakataon pipiliin ang chemotherapy kagaya ng hindi pagpili sa'yo. May mga parameters po kung kailan po dapat lang ito gagamitin at ito po yung tatlo na iyon. It may be combined with surgery, radiation therapy, or both. So, if the chemotherapy is done preoperatively or the neoadjuvant na tinatawag natin, meaning ginawa yung chemotherapy bago operahan yung pasyente, the goal of the chemotherapy is to initially paliitin yung bukol. Kagaya ng ipinaliwanag ko kanina, for example, sobrang laki ng dede ng pasyente dahil sa bukol. So pag tinanggal po iyon, ang tendency, wala na silang isusuture na area. Kasi hindi, pati yung skin sa sobrang laki, matatanggal na po. So anong gagawin? Papaliitin po muna yung bukol, and then pag maliit na ito, enough na para tanggalin at maisuture po at maisara ulit yung sugat, saka pa lang po magkakaroon ng surgery. Now, pag ginawa naman po ang chemotherapy post-operatively o pagkatapos operahan o yung tinatawag nating adjuvant, the goal of the chemotherapy is to destroy any remaining tumor cells. For example, tinanggal yung tumor sa lungs, na chemotherapy pa rin as a combination therapy. Ang goal po is matanggal yung ugat or matanggal yung mga remaining tumors kasi natanggal na din naman po yung ibang tumor because of the surgery. And if it is done on a primary basis, ito yung binibigay yung chemotherapy kasi hindi naman pwedeng operahan ng pasyente like leukemia or lymphoma. The goal of the chemotherapy, whether to cure, to control, or for palliation, will determine the medication that are used and the aggressiveness of the treatment plan. And speaking of medication, now let's have a review of the chemotherapeutic agents. But first, let's describe ano ba yung sinasabi nating chemotherapeutic agents? These are group of medicines that contain chemicals which are toxic to cells. Therefore, if they are toxic to cells, they prevent the replication of growth, and therefore, they are used to treat cancer. They are also termed as cytotoxic drugs or the anti-neoplastics na tinatawag natin. So pag nakabasa tayo sa ibang libro at ang term nila is cytotoxic drugs, chemotherapeutic drug din yun. Or even anti-neoplastics, anti-neoplasm. May mga books po kasi na ganun ang ginagamit nilang term. These drugs can kill the cells or they can alter or stop the cell cycle, eventually also killing the cells. You have to remember that every time a tumor is exposed to a chemotherapeutic agent, a percentage of the tumor cells, say for example 20% or even 90%, depende dun sa dose, namamatay po iyon. Pero kinakailangan pa rin po that repeated dose ang ibigay sa pasyente over a prolonged period to achieve the total regression of the tumor. Sana malinaw po yun. And let's also clear each description. Pag sinabi natin chemotherapy, it is the whole process of inducing the cell death by means of the chemicals. Pag sinabi natin chemotherapeutic drugs or chemotherapeutic agents, ito na yung mga actual medication or mga chemicals na ini-infuse sa katawan ng pasyente to kill the actively proliferating cells. So yun po ang pagkakaiba nilang dalawa. This is what I am explaining a while back. Chemotherapeutic drugs kill the cells as the bottom line. Kasi yun naman talagang gusto natin, di ba? Mamatay yung mga actively proliferating cells, especially yung mga malignant cells. At yun naman po talaga ang ginagawa ng chemotherapeutic drugs as a bottom line. May iba't ibang pamamaraan lamang po papaano po mapapatay yung mga actively proliferating cells na iyon. Now, may mga klase po tayo ng chemotherapeutic drugs and they are termed as cycle-specific agents kung saan para mapatay po nila yung cells, they will either alter or they will stop the cell cycle. Sa cell cycle po kasi, syempre that is the process kung paano nagkakaroon ng cell division. So, isipin natin, kung mai-stop natin yung cell cycle dito, 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 o kahit saan pang parte ng cell cycle, mahihinto ang cell division, the cell will no longer be capable of replication. At syempre, kung walang replication, walang pagdami. Kung walang pagdami, the cells will eventually be eradicated. But another thing to remember, yun daw pong 100% na eradication ay imposible. Instead, ang goal daw po ng mga chemotherapeutic agents na yan ay yes, to kill the actively proliferating cells, to eradicate them sa pinakamaraming pwede nilang mapatay. At yung remaining na tumor cells can be destroyed by the body's immune system. Okay, ulitin ko. Hindi lahat ng chemo drugs act this way. That is why there is what we call classification of chemotherapeutic drugs. They can be classified by their relationship to the cell cycle. They can be cell-specific agents or cell cycle non-specific agent. So ito yung pinag-usapan natin kanina. Kung saan, again, pipigilan o i-alter nung chemotherapeutic drugs yung replication ng cells para mamatay yung cells. Pero may tinatawag din naman tayong cell cycle non-specific agent. Ito yung wala po silang kinalaman dun sa cell cycle pero kaya pa rin po nilang patayin yung actively proliferating cells. These agents usually have a prolonged effect on cells, leading to cellular damage or death. Many treatment plans combine these two, the cell-specific agents and the cell cycle non-specific agent, to increase the number of vulnerable tumor cells killed during a treatment period. Okay, so pwede natin silang ma-classify into two. Aside from that, they can also be classified based on their chemical group, kung ano na yung actual content ng chemo drugs, each with a different mechanism of action. It can be alkylating agent, nitrosurias, antimetabolites, anti-tumor antibiotics, plant alkaloids, hormonal agents, or even miscellaneous agent. So sana may ring na sa atin, ano? Kasi I guess narinig na natin ito, mga chemo drugs na ito. And you can find that on the next slide. So you have here the drug class example. You also have here, what are their mechanism of action, the cell cycle specificity, and their common side effects. So, balikan na lang po natin yung ating nursing pharmacology. Andito na din naman po iyan para ma-familiarize po tayo lalo. Next to that question is, paano naman to ina-administer? Itong mga chemo drugs na ito. Yung mga chemo drugs po na ito can be administered sa ospital, sa outpatient center, or even sa home setting. Siyempre, kung home setting po ito, malamang ay hindi ito ibibigay through the vein. But instead, ito yung mga chemo drugs na binibigay orally. What are the routes? Topical, oral, intravenous, intramuscular, subcutaneous, arterial, intracavitary, and intrathecal routes. And the most common that we nurses can encounter is the intravenous means that is given in the hospital setting, augmented by the oral route given at home. On the next slide, you can see how do we give the intravenous route. So we will talk about that later. But let's proceed to the dosage first. The dosage of the anti-neoplastic agent is based primarily on the patient's body surface area. So kung gaano katangkad yung pasyente, gaano kabigat yung pasyente, kinukompute po ito at doon po ibibigay kung gaano katangkad, kabigat based on the body surface area, kung ano ang dosage, ilang milligrams, ilang vials. So ito po ay tinatawag na individualized. Aside from that, the previous response of the patient to the chemotherapy or the radiation therapy can also be considered, and also the function of the major organ system. The dosages are determined to maximize cell kill while minimizing impact on the healthy tissues and subsequent toxicity. Paano yon? Yung dosage daw po ay kinukompute base sa kung ano yung amount na ibibigay sa pasyente na enough lang para mapatay yung cells at enough lang din para ma-consider na hindi masyadong ma-damage yung mga healthy cells. And also, para ma-consider yung mga toxicity sa katawan. So, hindi pwedeng bira ng bira. Kahit ito po ay aggressive treatment, kinakailangan i-consider pa rin po natin na enough dosage lamang, again, to kill the malignant cells and to preserve yung mga normal cells sa katawan. So, again, this is individualized. Balikan natin. Paano nga ba ibinibigay ito intravenously? Sa tatlong pamamaraan daw po. So ito po nakikita ko sa mga pelikula, no? Pero once po ako nakakita ng central line. A cannula, a central line, or a PICC. So yung cannula, that is the normal insight na ini-insert natin sa pasyente. A central line, as you can see here, it is a long, thin tube inserted into the vein in the chest. So nakadirekta na po ito sa may dibdib. Yung PICC naman po natin o tinatawag na peripherally inserted central venous catheter. Saan naman po ito naka-insert? Ito naman po ay naka-insert sa vein ng arm that is threaded through the vein in the chest. Meaning, ang delivery po ng chemo drugs intravenously ay nakadepende syempre sa kung anong chemotherapeutic drugs ang ibibigay mo and of course sa preference ng pasyente po natin. The intravenous route also is the fastest approach that the healthcare provider can deliver yung mga chemo drugs na yon. But, syempre, it has common side effect or common complication, I must say, that when not given properly can harm the patient. Ano yun? Ito tinatawag nating extravasation o yung pag-leak nung gamot na ibinibigay natin sa subcutaneous area that can cause necrosis kung hanggang saan po nagkaroon ng pag-leak or pagkatas nung chemotherapeutic drugs. Antineoplastic agents are additionally classified by their potential damage to soft tissue if they leak to the vein. The consequences of extravasation range from mild to severe tissue destruction depending on whether a chemotherapeutic agent can be an irritant, a vesicant, or an non-vesicant. So, depende pa rin kung again, ito ay irritant, ito ay vesicant, ito ay non-vesicant, kung gaano ang extent ng damage na pwede nitong madala sa subcutaneous tissue pag nag-leak po ito. If it is irritant, nagkakaroon lang po ng inflammation. But, hindi po ito nagkakaroon ng permanent tissue damage. Thank God. Pag irritant, yung klase ng chemotherapeutic drug. Pag vesicant naman po, kaya po ito nakapula, no? Pag vesicant po, ito po yung mga agent na kung madideposit po sa subcutaneous tissue or magkakaroon po ng extravasation can cause tissue necrosis, even damaging the tendons, the nerves, or even the blood vessel. Paanong paraan daw po? It has something to do with the acidity and the alkalinity of the chemotherapeutic agents. Or in simpler term, it has something to do with the pH of the antineoplastic agent. Ito po ang responsable for the severe inflammatory reaction na nagli-lead sa pagbakbak or ulceration, na nagpo-progress sa tissue necrosis. Pwede din pong kapag sobrang pangit na po ng prognosis is magkakaroon pa ng skin grafting. So, luckily, if it is non-vesicant, syempre, wala po siyang ganong capability sa vesicant. But still, we have to take note that extravasation is one of the most common complication na pwedeng pigilan ng mga nurses. So, dapat aware po tayo sa extravasation. Actually, extravasation happens in every situation na nagkakaroon ng leakage sa subcutaneous area. Pwedeng nagkakaroon ng phlebitis for IV or IV infusion. Pero when it comes po kasi sa therapeutic drugs, talaga nakakasunog po ito ng subcutaneous fats. At hindi lang subcutaneous fats, even the muscles, even the tendons, parang naaagnas ng buhay yung pasyente. Depende if it is mild or severe. So, dapat yung mga nurses should be aware of this extravasation now. Paano kung mangyari to sa shift mo? Anong gagawin mo? If extravasation is suspected, the medication administration should be stopped immediately. And dependent on the drug, an attempt is made to aspirate the remaining drug from the extravasation site through the existing needle. And that is to decrease the amount of drug leaked into the subcutaneous tissue, also decreasing the chance of necrosis. Tandaan, kahit nasa kalagitnaan pa yan ng treatment, stop. Kahit mahal mo na yan, pero nagkokos naman yan ng harm sa'yo, stop. Okay? Stop the medication. Key points. The medication work differently at different effects. Not all chemotherapy medications work in all types of cancer. Drugs may be given as a single medication or may be given in combination with other medications. The regimen may be a single day or a 3 to 5 day in a row, then the rest period. So kung ang treatment ni Pedro, let's say, ay isang araw lang, maaaring ang treatment ni Juan ay kaiba sa treatment ni Pedro. So huwag kang magtaka. So hindi ito parang paracetamol na pag nilagnat, adult, lahat bigyan ng 500 milligrams. Ang chemotherapeutic drugs po, individualized po ito.